been identified over the last few years that as a region and as a hospital we had a very high cesarean section rate. Obviously this was of concern to care providers, physicians, nurses, midwives that work on the ward, and also to our senior administration. We found that one of the variables that really stood out was the fact that women in our health region that would be ideal candidates for having a vaginal birth after a previous cesarean section were not opting to have vaginal births, rather they were having elective cesarean sections.
I honestly wasn't sure if that was an option for me, because I kind of was again under the assumption that I maybe would have to have a C-section again as I had one previously. But once I started asking some questions and stuff, then Dr. Wasko was very supportive of telling me about this new initiative for the VBACs, and I was very interested in it, and yeah, had that discussion with him and decided that's the route I want to go.
So we undertook to create a process whereby providers were well informed about the safety of trial of labor and VBAC, as well as the patients, and this is part of that public awareness.
I'm really looking forward to being able to hold my baby immediately after. I wasn't able to really even see my child after I had the C-section. My husband was able to go with, but it took a while before I got to hold her and have her with me, so I'm really hoping to be able to have that skin-to-skin contact right away. Yeah, just to have a quicker recovery with having a VBAC. I do have a 4-year-old at home, so I'd like to be able to, be up and mobile and recovered quickly, more so than I was the last time.
As long as patients know all of the necessary information, the choice is theirs, and it's really what they feel comfortable with, and weighing the benefits of both options is important. And I think that's really our greatest goal, is for there to be all the appropriate and accurate information out there so that women can decide what's best for them.